Tonight, health officials say if the coronavirus was allowed to spread without any measures to stop it here in Oregon, it would grow so much we'd run out of hospital beds.
OHSU issued that projection tonight. Our Jennifer Dowling talked to health officials. She joins us now live with a breakdown of some of those numbers. Jen?
That's right, Jeff and Jennifer. If this thing went into a worst case scenario, OHSU and OHA says we could need an additional 1,000 hospital beds just for acute patients alone. That does not include intensive care beds. So things could quickly ramp up again if things are not slowed down. That's why the governor and health authorities are trying to put measures in place in order to stop the spread.
This is so crazy.
Matthew El-Zafiri took to the streets of Portland this week carrying a message for those who aren't serious about the coronavirus.
Switch your hand, because some people forget or don't care, or it's fine. No, I don't care about this.
He said he wanted to bring awareness to the situation globally. There have been deaths in his home country, along with those recorded here in the U.S.
Please, guys, be careful, be careful, be careful.
Meantime, OHSU and state health officials are charting a possible number of hospital beds that might be needed in a worst-case scenario if the spread isn't stopped by social distancing and other measures. They say based on the spread in other countries, possible cases have the potential to double around every 6 days. By mid-April, health officials estimate statewide they'd need an additional 1,000 acute care beds, which is shown in the blue line on this graph, and another 400 intensive care unit beds, which are charted in yellow here. In Portland alone, an additional 700 acute care beds would be needed. Again, that line is shown in blue, and they'd need another 300 ICU beds. The skyrocketing need is shown on the graph there in yellow. For OHSU alone, its health experts say that would mean its facilities would need to somehow double the available ICU beds within the next few weeks, unless the current precautions, including closures and other state mandates to stop it, work, and personal protective measures as well.
Be careful and watch your hand.
Also today, Governor Kate Brown issuing an order asking all healthcare facilities, that includes veterinarians even, and dentists, not to perform non-emergency procedures in order to preserve that protective gear that healthcare leaders and officials so desperately need in order to treat those coronavirus patients and others. So we'll have to wait and see exactly what the numbers bear out. But again, that was a worst case scenario. Back to you.
Jennifer Dowling reporting live for us tonight. And I know